So for those of you who don't know, I'm Dr. Aman Arora. I'm a portfolio GP, but now full-time, 24/7, 365 in medical education. My passions are twofold. Number one, to help you through your exams. That's obviously a big part of what you guys have in front of you in terms of your career. But secondly, to try and maximize your potential within the NHS or within your medical careers, because we have so much potential and we don't often demonstrate it. We don't often reach that potential. And that's one of my huge passions, trying to allow you to maximize not just your exam scores, but also your potential in your career as well. I've had lots of previous roles based in medical education, examining, writing questions on various boards. And I had a great time building up experience, building knowledge, creating networks and contacts. But as you know, recently we have founded Royal Medical Education, and we do lots of training for various exams, from med school through to PLAB, through to specialty entry, right through to MRCGP and beyond. And our passion, like we said, is not for me to say how you should learn, but to offer you a variety of different teaching styles. I'll be going through some of the things that we do in a second. But the main point of this talk is not to talk about the resources that we have. It's about allowing you to maximize your potential and how can you strategize your exam preparation, whether you're preparing for medical school exams, PLAB 1, PLAB 2, MSRA. There's some things that overlap, and we'll try and look at how you can reach those maximum points. So what are the aims of this session? I'm going to talk a bit about the pass cycle, what that is, and how you can maximize your time leading up to your exam, however long you've got left, whether it's 3 weeks or whether it's 3 months or even a year. The potential barriers that can stop you from maximizing your potential, stop you from reaching that high score that you know you're capable of. What are they, and how do we clear some of those out the way? What are some of the strategies that we can look at, both from a preparation point of view, but also a mindset point of view, because both of those are equally important when it comes to preparing and maximizing for exams? And then ultimately, how can we help you with some of these things that we talk about through this scenario? So please do ask questions along the way. This is your session. I want to get your questions answered. There are lots of common queries that I'll be going through that I get asked quite commonly, but it'd be good to see what you've got as well. And we'll do a bit of a Q&A at the end. I'll try and whiz through some stuff at the beginning and then do a bit of a Q&A before we lead into our lunch period. So obviously, huge range of medical exams, and they all take a little bit of strategy in terms of specifics, but there are a couple of things that you guys are probably preparing for right now that we'll try and focus on in a broad way. So obviously you have your basic knowledge-based MCQs. Do you know X? Do you know Y? These are typically your kind of medical school exams, just to try and get used past a certain point of, do I know enough? So as you go out your career, you get less and less of these and more kind of application-based MCQs, thinking things like PLAB 1, thinking things like AKT, where they kind of assume that you've got the knowledge by now. It's not that, you know, what are the 5 causes of left heart failure? It's, okay, you've got a patient who's got some symptoms, you've got to work out that it's left heart failure, look at past medical history, look at what drugs they're on, and think about what would be the most appropriate solution. So a level up from knowledge-based MCQs. You have obviously SJT, situational judgment tests. A lot of assessments use these types of questions now, right from medical school through to MSRA. Of course, there's a whole paper on SJTs. Here it's looking at the way you kind of approach a professional dilemma or professional situation. How would you manage a situation that's not clinical, but something to do with your professional working environment? Obviously, observed clinical exams. So PLAB 2 has some observation of your clinical skills in there. Again, these are mainly kind of in medical school. Can you do a particular type of clinical examination, for example? Observed role play based exams, recorded live consultations. Now with COVID coming out, lots of new assessments have changed into the, you know, you record what you're doing at work and then we'll assess you from there. So particularly RCA, for example, as part of MRCGP. And then of course you've got your interview assessments. Now, all these are very different. And as you go through your career, you'll probably do 4 or 5 of these types of exams. But let's look at some common themes that go through whichever type of exam you're approaching for, so that you can ultimately maximize your potential going forward. So this is the pass cycle that we talk about. What are the kind of things that you can do to try and maximize your chances and score that extra 5 or 10%? Because yes, you might get to a pass, but actually have you hit your potential? And what can we be doing along the way, try and make sure that we increase our chance of doing that? So it starts with awareness, and we'll go through all of these in a bit of detail in a second, but being aware of what the exam is all about, what the preparation resources are. If you're not aware of things at the beginning and you're finding things out as you go along this cycle, then you're reducing your potential automatically. Planning, of course, is a huge part of anything, particularly in medical exams. It's amazing how many times people don't spend a bit of time at the beginning planning. We'll talk about what sort of things to think about in that planning phase in a second. Of course, you've got to build your knowledge up to a certain point, and we'll talk about how to do that, what strategies, what techniques, and how you can get your knowledge from 80 to 90, for example, because it's not often just reading more and more and more, but we'll look at that in detail. Technique is a hugely undervalued part of preparation. People tend to focus on the knowledge part. Let's just learn more and more and more and more, but that doesn't necessarily reflect in higher and higher scores. You've got to start paying a little bit more attention to technique. What am I doing right? What am I doing wrong? Why am I doing that? What sort of techniques are being looked at? And this is a little bit deeper look that we'll look at in a second. And then of course, application. So like we said, there are knowledge-based exams where it's just, do you know X versus Y? But most exams now that you'll be praying for, but certainly for the guys that we've got on this webinar, this conference, are testing applications. So how do you look at improving that side of things, adding to the knowledge that you have and adding to the technique that you've looked at? So I'm going to break these down one by one. But ultimately, all this stuff is great, but another massive component and something that we really touch on a lot when it comes to our teaching and training is your mindset. If your mindset is not right, yes, you can put all the steps in, but if you're not at the right place in your mind, then you're not going to maximize your potential, because lots will come in the way. Self-doubt, confidence, remembering failures, all this kind of stuff will get in the way, even if you've done the steps of maximizing that potential. And certainly this is something that I see a lot of, and we do a lot of work on that as well. And we'll talk about how we can get this in the right place so that, again, these things can be put into much better value and much better use. Of course, there are barriers, and you know, I train doctors and medical students every single day, and I see these barriers repeat again and again and again. Time obviously is an issue depending on when you start, how long you've got left. Focus is a difficult thing, how to stay on board with something. Life, you know, life events happen, things that are not expected, things get in the way. It can be a huge barrier. Confidence, like we talked about, very, very draining on you if your confidence is not there. So how do we pick that up a little bit? It's very easy to just say be more confident, but how do you do that? We do a lot of comparison. We look at competition a lot. That's human nature. We compare ourselves to previous exams. We compare ourselves to other people. What are they doing? What are they getting? That's a huge energy drainer. Competition, of course, we're always worried about what other people are going to do. And if there's only a certain number of people who can get a certain position, for example, we start to think about the competition. And of course, historical baggage, you know, going back, if we've failed an exam once, twice, 3 times, you can do all the steps. But if you've got a lot of baggage here, very hard to overcome that. And all these can add up very quickly to make it very difficult to get yourself in the right mindset. And we'll talk about strategies to deal with all 6 of these as we go through this talk. So let's go back to that cycle then. So remember, the first thing we talked about is awareness. If you're not aware, if you don't take the time out to be aware of what you can use to your advantage, then you're missing out on tricks. Now, you might miss out this thing altogether and just start your preparation from day one, but you're probably going to have to work that little bit harder to deal with some of these things that are kind of come up in the middle. So for example, early on, if you're about to start preparing for PLAB 1 right now or AKT right now, start a little bit aware of what kind of things are there out there right now that can help me jump up steps quite quickly, rather than be having to sort of slowly climb up the ladder myself. So read official guidance. It's amazing how many times you see people who have started to prepare for an exam, but they've not really read the guidance that's been put out by the organization or the deanery or the board or the college that are actually preparing that exam. So for example, for AKT, there'll be official guidance on things like what topics are going to be tested on, or in PLAB, for example, there's an official PLAB blueprint. And it's amazing how many times people haven't looked at this. So they're not aware of what are the kind of things that are going to come up. So they're relying on other things or other people to get them to the right space. So start to spend a bit of time looking at what's out there. Read blogs. There are so many blogs written by doctors who have done these exams before, medical students who have done these exams before, people who have passed, people who have not passed. Look back, you know, success is a path that's been trodden many times before. Look back at clues, read what's out there. Yes, you might get a little bit overwhelmed by the number. Just choose 2 or 3, look at some highly recommended ones, and start to understand where people have been. So again, it can cut corners in your own preparation. It saves you having to work things out, make those mistakes yourself, and miss things out. Look at curriculums like we mentioned. Again, lots of exams these days, in fact, most exams these days, tell you what are the kind of things that are going to be assessed. It's amazing, again, how many times people don't look at these things, and therefore you kind of walk into a big blank area of I need to cover everything, when actually maybe you don't need to cover everything. Maybe you can cut some time by cutting out some topics that are not going to come up that you presume may be in there. Look at marking schemes. You won't always get an idea about how you're going to be assessed, but in certain assessments, you get a lot of information about how things are assessed, what areas are looked at, how you're going to be marked, real specifics about what are the sorts of things that you're going to be expected to demonstrate on that day, maybe if it's a communication skills exam, or if it's like the old CSA or PLAB 2, look at the mark scheme, look at the areas that are being assessed on. Again, if you don't know this, how are you going to prepare effectively? You can put the time in, but it doesn't mean it's going to reward you the way that you think it should. Look at past reports. I think about AKT straight away. Every single time there's an MRC GP AKT exam, the Royal College of GP sends out a report saying, this is what people found easy, this is what people struggle with, these are areas that people really found hard. It doesn't make, it makes a lot of sense. These are going to come again in the future. So if you haven't looked at past reports, again, you're not being aware of the types of things out there that can really help you maximize your potential. And then, of course, look at examples of questions, examples of cases. A lot of boards and deaneries and colleges have examples on their website. So if you're not utilizing these things, you're not aware of the kind of levels that are being looked at, so you're walking in blindly, and that can make and take a lot of energy, but not necessarily in the right direction. So that's early on, that's before you even start. But what about throughout preparation? How can you stay aware of things as you go through? So regularly look at the websites to make sure there's no changes to content, for example. So things like NICE guidelines, things like BTS guidelines. Keep looking at these things because things can change, and there's a bit of a lag sometimes between when something changes and when it reflects in the exam. But if you haven't been aware of content changes, you might be surprised 2 or 3 days before the exam when you realize someone says, well, that's actually changed 3 months ago and you had no idea. So make sure you're aware of these things. Look at exam updates, especially with COVID at the moment. Things are going on all the time, and you don't want to be the last person to find out that the style of an exam has completely changed. So make sure you're monitoring it, you're on top of it, and you're aware of things. Social media groups are a great form of staying on top of things, being aware of changes. Sometimes you don't need to go looking yourself because you've got people who are posting about things all the time. We have a couple of groups that Pooja might be able to put in the chat, one for GP training, one for PLAB. But these kind of things keep you aware. Don't bury yourself in the sand. Keep aware of these things. Ask questions, of course, whether it's on social media groups, whether it's to colleagues. Always ask questions because you stay aware that way. And then stay aware of your own progress. So keep a monitor of your scores, keep a monitor of your checklist, keep a monitor of how you're doing and how you're progressing, so that you can adapt, so that you can turn things around and change if things are needed. If you're not aware of these types of things, you're just going to go down a tunnel and come out the other end, and maybe you've got a lot of gaps in there. So awareness is a huge part of maximizing exams. Once awareness happens, you've got to start doing some planning. So it's one thing to just be aware of everything. You could know all the information in the world, but if you haven't got a plan then in place to focus your preparation, you're going to be leaving marks behind. You're going to be leaving energy behind, and it's going to impact your overall performance. So what are the kind of things that you can plan to make sure you maximize the 3 weeks, the 3 months, the 1 year, however long you've got? Timeline, super, super important. If I know I've got an exam in 3 months' time, I'm going to write a timeline between now and that 3-month period. We've just started to release our timelines for you. We've just done an AKT 120-day timeline that started 3 days ago. Just go to the website, it's a free download. Every single day is counted for, what you need to cover, what topic. Now, you don't have to go to that much detail, like we've done a day-to-day guide, but maybe a week-to-week guide. By the end of this week, I need to have hit this many modules, this many topics, this many questions. By 2 weeks, this many. By 3 weeks, this many. If you don't have that plan, the pressure is huge because you think there's so much to cover between now and the end point. But when you start to break it down into chunks, you don't have to worry about the end point. You just got to worry about your week. Because if you get this week right, and you know you follow it week, by the end, you'll cover everything. So timelines are super important. If you don't do them, the stress becomes huge. Have buffer periods. So yes, we all know that life happens. We mentioned it early on. So in your timeline, factor in buffer periods. Have a week in the middle that is a catch up. Have a few days somewhere where there are catch ups. So you know you're not stressed that if I don't follow this every day today, I'm going to struggle. You've got those little catch up periods. And we talk about this 0.2 rule. So this rule. So if you have it between now and, say you've got 5 months left between now and your exam, in your timeline, don't timeline right up to the end. Have the 0.2 rule. The final fifth of your time period should be kept free. So if it's a 5-month plan, you should be cramming everything into the 4 months. And leave that final month free, because life happens, things happen that you need to catch up with. You need to go over 2 or 3 things again. Aim for the 0.2 rule. So if I've got 5 weeks to go, timeline should be 0 to 4 weeks, and you've got that final week as a buffer, final catch up, get your mindset right. Don't plan right up to the day itself. So timelines are important, but do them well. If you want timelines, then head to our website. We've got a few pre-plugged in for you. Plan your resources, right? Don't just start with one resource and then think it'll cover everything. It doesn't work like that. You've got to plan 2 or 3 different things, but also 2 or 3 different learning styles. Just because somebody is doing really well by watching videos and learning that way doesn't mean that you need to do the same thing. try 2 or 3 things out, particularly if you've got a few months to go. You don't need to decide how you're going to do everything in the first week itself. So try listening to some audio stuff, try doing some past questions, try watching videos, try talking things out to yourself, see which style works best, and maybe just mix it up, try different things. But again, if you don't plan all this at the beginning, you're just going to jump into a tunnel, do one thing for 5 months, and maybe it's not the best thing for you just because somebody else is doing it, and maybe you reduce your potential. So time your steps as well. So for example, I've got a 5-week timeline. For the first 3 weeks, I'll do questions, and then at the end, I'll do mocks. Like getting this kind of stuff in place and knowing in your mind where you are in that plan with your resources is super important. Because again, if you don't do it, it's not that you can't pass things, but if you do it, you maximize your chances tenfold sometimes. Plan escapes really important. A really important part of planning is planning your downtime, planning escapes within study. So for example, having those break days, every 5 days have a break day, every 6 days have a break day, so that you've got something to look forward to and draw you towards. And then plan for when you complete periods. So if I complete, I don't know, 1,000 questions, then I'm going to do this. If I complete, I don't know, 5 chapters, I'm going to do this. So plan your escapes, because sometimes it gets quite monotonous, quite boring, quite draining. And if you haven't got things that you know are factored in that are going to give you a release, then it can be quite, you can lose interest, you can lose focus, and we'll talk about this in a second. And plan for down days. This is super important. It's one thing to have a plan to say that I'm going to do this every single day. Plan that some days you're just not going to be in the zone. You're just not going to feel like doing it. That's why break periods and buffer periods is so important. You're almost predicting that your brain is going to give up a little bit at some point. And then if you have planned for these, then you're not going to feel so down when it happens. The pressure doesn't build so much. So again, if you don't plan, you can do all the hours that you want, but it doesn't mean it's going to hit you in terms of effectiveness as well as you can. Let's look at knowledge then. So knowledge is really important, of course, a bedrock of all exams. If you don't know your knowledge, then you can't apply anything. So you do need to know things, but often we go about things in maybe the wrong way, or a way that just puts too much pressure on us. So for example, you've got to know when to stop with knowledge. Say, for example, you're looking at hypertension. You could go on forever in terms of hypertension. There are so many things you could read, so many guidelines, different guidelines here, different guidelines there, every single drug change, dose change. There's so much that you can learn that there's no end to. Now, you've got to be a little bit savvy about knowing, hey, this goes back to what the assessment is looking for. What are they assessing of me? For example, if you're doing an AKT type of question, your knowledge of hypertension and the little steps and the intricacies have got to be pretty high, because that's a pretty fundamental part of primary care, something that you see every single day. You've got to know, you need to know that in pretty much detail. But by the time you've got past AKT and you're into RCA, for example, you've still got to know your hypertension guidelines. You don't get me wrong, you still need to know what you need to do in a certain situation, but maybe the depth of what you need to know for RCA is slightly different, because now they're looking at how do you manage a situation which includes someone with hypertension, which is slightly different. So knowing when to stop is really important. Otherwise, you just put in too much energy to every topic that you do, and you end up running out of time. So for example, you've got in-depth areas and you've got surface areas. Have an idea about what are the things I need to go 4, 5, 6 levels into, and what are the things I can just know maybe the top 2 levels. If you don't think about this, you're going to try and go in depth for everything. And if you've got a curriculum which says 500 things and you're trying to go in depth for everything, you're going to burn out, you're going to struggle, you're going to run out of time. So have a bit of an idea about, okay, this is my in-depth category, this is my surface category, and it gives you a bit of breathing space. Different methods to boost retention. So, you can read something and you'll forget it in 3 days' time. So you've got to figure out how your brain works. So don't do something because somebody else is doing it. Figure out your own way. So for example, if you're reading a guideline or reading some flashcards or something like that, maybe try a few things. Try reading it on one day, and then try reading it the next day and see how long you remember it. Next card, try reading it on one day, try reading it again a week later and see how long you remember it, because your brain will work well in one way that you need to figure out. Whether you read something, some people can read it once and it's fixed, that's fine. Some people can't do that, you need to read it 3 times, but you need to try and test as to what is the right scale for you so that you can boost retention for as long a period as you can, or at least up to that exam, just so you know it's in there ready for that time. But work it out, it's not going to come just by you guessing. Shared knowledge boost, super important. Your knowledge can be good to a point, but when you share it with somebody else, it strengthens that knowledge. So you might have study groups set up, you might have WhatsApp groups, you might have social media groups, but keep regularly sharing knowledge. Get someone to teach each other something. Have a topic that I'm going to do hypertension this week, then I'm going to teach you guys virtually. sometimes sharing knowledge forces you to understand it a little bit more. And when you're hearing somebody teach it who's understood it inside out, you understand it a little bit more. So don't keep it all to yourself. Don't try and do it all yourself. Share knowledge boosts. Knowledge surges. These are really important. Why do we do webinars 3 weeks before an exam? Why do we do webinars a month before the exam? Why? Because we're surging your knowledge. We're giving you these little boosts and spikes of knowledge that can really help to save you time. So look at what's out there. For example, for MSRA, PLAB 1, AKT, we always do webinars close to exams where we pile on lots of knowledge in a very short period of time. These are the surges that you need to look at. Number one, because they boost your knowledge, boost your confidence. But secondly, they give you that trigger that, okay, actually, there's a lot of stuff that I need to know. I need to get back onto it. Sometimes you have dips. You need those surges to get you back on track. So look out for what's out there, what knowledge surges are around that you can use and utilize them. And know your recap pattern. So you need to know, like I said, when you go back over things, what is the pattern for it? And in your timeline, make sure you schedule in recap sessions. Don't just have everything new learning, new learning, new learning. Recap is super important. It's no point reading everything, forgetting it in 3 days' time. Know your method to boost retention. And by doing all of these things, your knowledge should be up to a certain point so that you can start to do the other bits like application and looking at technique. But if you fall down on knowledge, then a lot of the rest of it will fall down on the side. Technique, super, super important. And I put in 90% overlooked. This is not a figure that I've got from any evidence. This is what I have seen people do over many years of training people for medical exams. People overlook technique to a massive, massive degree. They focus on knowledge 100% or maybe 95%. You've got to look at technique. Now, let's look at MCQ type things first. We talk a lot about this in our AKT teaching, MSRA teaching, PLAB 1 teaching. And it's amazing how many times when we do questions with people on webinars, for example, how many of these technique things are opened up, mistakes that you're doing again and again and again that are going to cost you on the day. So for example, in MSQ, simple things like making your brain learn how to look at small versus big words. You know, our brain goes for big words first. We look at a question, you see the word hemochromatosis in the question, you look at the answers, you see the word iron in the answer or vice versa. Your brain makes that connection. They're big words. So you often put those for answers, but actually they're not the actual answer for the question, but your brain has just focused on the big words. Small words are things like often, may, least, can. These things change everything. But because our brain focuses on big words, your technique is not great. You're losing marks because you're missing words, not because your knowledge is not there. Super important. Soft words is hard words. Very little is 100% in medicine, right? So your brain should subconsciously be rooting out hard words, always, never. Very rare are they going to be the right answers because very little is 100%. Soft words, however, should increase the chance of an answer being right. Can, may, often, sometimes. These soft words play a big part in questions. Hard words should as well, but if you're not aware of them, then you're not using technique to your advantage. Double words to single, which one of these is not true? Which one of these is least correct? Change every double word to a single word. Put less pressure on your brain. If you're not working on technique, you're putting extra pressure when you're reading the question, it leads you to losing marks. The worst thing is losing marks, not because you don't know what you're doing because of knowledge, but because you haven't got your technique right. What sort of person are you in terms of questions? Do you benefit from reading the answers first, then looking at the question? Do you benefit from almost covering the answers, reading the question, and then looking at the answers? See, how do you know whether it's right for you unless you test it? You've got to test these things. So, for example, do 50 questions in a row where you almost hide the answers, read the question, think about it, think about the answer, and then look at the answers. Then do another 50 questions the other way around. Look at the answers first, understand what the answers are, then have a look at the question. Do that 50 times in a row, each way, probably twice, and look at the results. You'll see a 6 to 7% difference straight away because your brain will either work better by reading the answers first, or it'll totally work the wrong way. But unless you test it, then you're never going to know. You're going to do what everybody else tells you should be doing. You're end up losing marks. You've got to know your own brain inside out. Visualize, very important. When you're looking at an MCQ question, I think about AKT, very long stems sometimes, lots of information. You're reading it word for word for word for word. By the time you get to the 10th line, you're forgetting all the detail at the top. You have to go and read it again. Start to visualize it. See the 34-year-old lady who walks in the door. See the fact that she has a fever. See the rash on her face. See the blood pressure on the scale. See, when you start to build up a picture, an image of what you're reading, number one, your brain works better because you can work better in images. Our brains work much better in images than words. And secondly, you'll save time because you're not going to forget the look of the rash on that cheek. You're not going to have to go back and reread it again. You're not going to forget that she's got a temperature of 39.4 if you've seen her looking hot and feverish. So visualization, A, saves you time to read things again, and B, it allows you to make gut decisions much better. Now, these are like 3 or 4 things that we have like 15 or 16 of these that we teach about all the time. They can make the difference of 10 to 20% in an exam. You have to get technique right. People overlook it. What about role play based exams? Get your technique right. What are you trying to achieve? You've got 8 minutes or 10 minutes, PLAB 2, RCA, you've got certain amounts of time. What am I trying to achieve? By the end, I need to know certain things. Keep things simple. If you haven't thought about this, you just go and do a whole, you try and achieve too much within 10 minutes, time runs out. So for example, we talk about big picture data gathering. Don't think about the nitty gritty too much. Think about the big picture. We always talk about 3 bubbles, red flags, psychosocial, ICE, 3 massive things to try and help you understand the situation so that you can think about managing in the future. If you don't have a plan, if you haven't looked at technique and you just go and do a history, you're going to run out of time. Think about big picture data gathering before small, tiny, minute details, things that are going to make a difference. Focus on big picture interpersonal. Yes, it's all about looking nice, feeling nice, saying the right things. Just keep it simple. We talk about 3 R's quite a lot: reasoning, reflection, relevance. When you're doing your data gathering, if you factor in reasoning, reflection, relevance, we cover this in more detail in our PLAB 2 courses, RCA courses, but keep it big. Keep the idea, but what am I trying to achieve? Simple things, not nitty gritty. Like, what is the right way to say this, or what is the right line to say when to show empathy? These things don't make you better interpersonally. Big picture makes you better interpersonally, seeing that thing as a whole. Big picture management. Like really often when I see PLAB 2 prep, RCA prep, going back to med school type OSCE prep, people focus too much, they narrow down too quickly in the first minute of management, and then you run out of time to mention everything else. Think big picture first. Let me get the situation covered first. Let me demonstrate that I can understand all the issues going on before I get trapped in one in particular. See, these kind of technique things are so important, but again, they're often overlooked. If you overlook them, you reduce the chances of demonstrating what you're able to do. You reduce the chances ultimately of the score that you get. So technique is hugely important, but very often overlooked. Application, the final bit then. So yes, you've got your knowledge, you've got your technique, but you've got to apply it on that day in the exam. How do you boost application? By doing practice, of course, but it's got to be done the right way. It's not just about doing 5,000 questions every week and hoping that it'll all come up to the plan. You've got to practice it and plan this. So whether you do question banks early on and then go into mocks so that you can get your time pressurized feature on, so you know how you deal with in the reaction to pressure of a clock ticking, for example, whether you do practice in study groups and vary it up, just make sure whatever you do, you feed back on it yourself, you look back on it, you break it down yourself, you go back through the questions that you got right and wrong and say, did I guess it, did I not? Would I make the same mistake again or not? What's the technique issue that I had there? What's the knowledge gap? And then you fill the gaps. Don't just do 100 questions, look at the score and move on to the next 100 questions. It's pointless. Make sure you do practice, yes, but in the right way, and be honest. If you do a role play practice with somebody, don't just think, okay, that role play done, have a quick discussion, move on. On the drive home that day, or when you're in your bed that day, think about the role play. Did I get all the right questions out? What did I miss out? What was my interpersonal like? How can I improve it? And then when you do the next session, you work on those things and you'll see your graph goes up. If you just do role play, discuss, next role play, discuss, next role play, discuss, you're going to stay at the same level. You might have small incremental rises. It's the self-critique, it's the bit that you do on your own afterwards that's so important. But practice is one thing, making it perfect means doing it the right way and being honest about it. And always be aware of balance. Always know that I've got to be improving knowledge and I've also got to be improving technique. Don't have the balance 99-1, have it kind of maybe 70-30. Like, you've got to do a bit of technique, otherwise you're always going to lack the ability to show the potential that you have. And remember, one of the things that we do or try and do is, yes, we teach you this stuff, but secondly, we focus on your technique, because if this bit's not there, you're not going to be able to hit your potential as well as you can. And all of this leads to the mindset. Why do you think the CAN pass will pass is that this is our kind of phrase that we use all the time? CAN pass will pass. It's all geared towards getting your mindset in the right place. If you haven't started with this, if you don't start with the thought that I can pass this exam and I will pass this exam, then you're already a notch down. You're already going to give yourself a bit of leeway to say, well, it wasn't meant to be, and I knew I wasn't going to do it right, and oh, I don't feel like working, but there's no point anyway because I'm not going to pass. If this bit's on top, then you're more likely to push yourself that a little bit extra percent. But what can you do to push yourself a little bit? Aim for 100. It's amazing how many times we ask people, look, what are you aiming for? Oh, I'm aiming to pass. Now, straight away, you're giving your brain a leeway, a gap. You're giving it a bit of a chance to not push yourself when you need to push yourself. Aim for 100. Doesn't mean you're going to get 100, but if don't give any marks away for free. Don't think that I'd be happy to give away 20 marks as long as I get 80. Why? Because then when you get to the point where you've got to push yourself 5%, you'll be like, well, I only need 80%. I don't need that one, so I can leave it. Subconsciously, you probably won't push yourself. In the middle of an exam, when you want a particular question and you're struggling, it takes a bit of working out, your subconscious brain is telling you, well, I only need 80%, so I can probably let this question go. It'll be okay. But straight away, you're letting yourself down, because if you're pushing for 100, you'll give it that extra 5%. You're more likely to get that extra mark in board, and that mark can make the difference. So always aim for 100. Don't think you'll get it, but aim for 100. Remember, backwards, think forwards. If you're ever struggling, think backwards. Look at all the exams that I've passed in my life, all the steps I've got through to get to this point. That will boost your confidence straight away. I've passed this. I got into medical school. I passed my final. I passed my, I don't know, part 1 of MRCP. I passed my AKT, whatever it is. Go backwards and revamp the positive experiences that you've had, and then think forward. You might be stuck in one particular exam right now. It might seem like the biggest thing in the world, but if you think forwards to your career, this is a tiny blip. It gets you back on track. It gives you that push that this little thing is not going to fail me. I've got 30, 40, 50 years ahead of me yet. So think backwards, think forwards, get your mindset right. If you don't practice these things, you get into little lulls, and before you know it, 2 weeks go by, 2 months go by, and you've lost the opportunity to do really well. Know your go-tos. Know that you're going to struggle on certain days, and plan your go-tos. Know that if I feel rubbish and I don't want to work, I'm going to ring this person. Know that when I have a day where I don't feel great, I'm going to, I don't know, tell my ES, my education supervisor, to give me a pep talk. I don't know, just have your plan. Don't think that when it gets down, I'll sort it out, because that's the hardest time to sort it out. Plan for tough periods. Know your go-tos. This is super important, and just expecting them, anticipating them is all part of the process. Don't think you need to be a superhuman and not have these things. If you do, you're going to get disappointed. Mindset is 100% important. Now, we talked about some barriers though, so very quickly, how can you get rid of some of these? And again, we go into much more depth in these on our YouTube videos and all the other bits that we do. But time, like, how do you beat that time thing? Make a timeline. Doesn't matter whether you've got 1 month to go or 1 year to go. Without a timeline, you're always going to feel you haven't got enough time. So when you put it to paper, you put less pressure, because you don't have to look at the end. You just look at the next 7 days or the next 3 days. Timelines really help build your time, and they focus you into short periods so that you can maximize whatever time you have left. And do have break days. You may think that I've only got a month, I can't afford a break day. That break day, that 2 or 3 break days that you have, are going to buy you 2 or 3 days in total, because you're going to keep yourself fresh. One of the reasons when we do our 120-day, 90 countdowns, whatever it might be, we plug in break days, because we know how important they are. Don't take them when you feel you're burnt out. Take them when you don't feel burnt out, so it keeps you going longer. How do you stay focused? Simple things like stop your distractions. Put your phone on silent. Better still, put your phone out the door. Like pinging your phone all the time, just checking everything's okay, is going to reduce your efficiency by 30, 40, 50% sometimes. Put your distractions away. Put food on your table, snacks on your table before you start. Don't just wait for you to get hungry and then think, I'll just go and get something. Why? It's a distraction. Your brain is distracting you. Get prepared for it. Tell other people. Super important. If you live in a busy house, you've got to tell people, look, this hour, this is my work time. Please, unless it's an emergency, don't knock the door. But if you're in the middle of a study session and someone knocks the door, there's no point getting frustrated with them. You've got to tell them, you've got to plan this so that your focus can remain 100%, so that you don't need to spend 6 hours doing the work that you can do in 3 hours, that you can then spend 3 hours afterwards. Focus means planning. It's not just about how do I be more focused, it's about putting things in place that allow you to stay more focused. Life, like we mentioned, things happen. You can't expect things to they're going to happen at times. It's fine. You've got to expect it, but have your break days, have your buffer zones so that you can make it time if you need to. Confidence, like we said, look back, look forward. Your confidence will be boosted by doing both, and expect dips. Expect that your confidence is going to go down. One day you're going to wake up and feel I can't remember anything. That's fine. Expect it. Have your go-tos. Know what you're going to do when it happens. Competition and comparison, again, a normal part, I guess, of exams. You're going to look at others. You're going to compare it to yourself. Choose your core group carefully. Like if you're going to do a study group, don't just pick any random person that you find on social media, because you don't know what they're like. You don't know how they're going to impact you. Try and choose people that you know, that you work well with, so you're not going to get this feeling of comparison versus competition, because that is a real drainer, and it really puts a barrier in terms of working effectively. And use it as a driver. So, if someone says something that upsets you from a comparison competition point of view, don't use it as a distractor that, oh gosh, how can I get that high score? That person got a high score, or that person, how did they fail? Like I thought they were amazing. Use it as a driver, use it as a positive spin. and you can make use of these things because they're naturally there. So rather than draw you down, dry you up. And historical baggage, like we talked about past failures, has a huge impact on our brains. Put it in perspective, we talk about longitudinal perspective and we talk about horizontal perspective. So everyone will say, oh, just put it in perspective, but how? Longitudinal is what we've been talking about, going forward and backwards. If you had a fail, you look backwards and remember all the passes that you've done, and you look forward and think, how many things have got to come in my career? It'll suddenly feel like a small blip, not a huge thing in your life. Secondly, lateral width perspective. Okay, your exam is one thing going on right now. When you look wide of you, you realize there's so many other things going on right now as well. Family, holidays, good times, things that happen, other things have to happen in your life. When you start to look width-wise, it becomes in perspective. It's just the exam. Whereas if you don't look longitudinally and width-wise, horizontally, then suddenly it becomes too much, and it's very hard to put these in perspective. And then reinforce a more solid base. So if you have failed an exam and you're about to restart an exam preparation again, tell yourself, look, it's not the same. I don't have to go and do everything again. My base is solid. I've got 50, 60% under my belt. Now this time I've got to fine tune. I've got to go back into more detail for a few things that I didn't pass. Not that, oh, I did this exam, put so much work in, I failed, and now I've got to do all that again. You just got to keep reinforcing. It's not all again. You've got a really solid base. Now you're going to change the way you prepare, and I'll get through it next time. These little things make a big difference going forward, because if you don't get these right, if you don't plan them, they're going to drain you. Right, a lot of you guys are asking, what can we do? Now, I haven't talked about what the exams are, PLAB 1, PLAB 2, MSRA, AKT, RCA. There's plenty out there on our channel that go through what the exams are. So the coupon, like I told you guys, if you want 15% off anything on our website today, is CONF15SAVE, CONF15SAV, just for today, just for webinar attendees. What have we got? MSRA, we've got our main gold package, which contains everything in a discounted bundle, our online courses, our mock exams, our flashcards, our audiobooks. You can either buy them separately, or you've got the all-in-one complete gold package. That's MSRA. If you're thinking about GP training, if you're thinking about specialty application, the MSRA stuff is for you. Hopefully Pooja can put some links on in a second. PLAB 1, if you're doing PLAB 1, same process. Gold package all-in-one, or individual products. Audiobooks, which buy you time, mock exams that put you under pressure, flashcards that give you things at a fingertip, high yield things that you need to learn. PLAB 2, mainly based on communication skills, an area that people struggle with a lot. Our Gold Pass package, again, our all-in-one, contains everything at a discounted rate. Or we've got our live course where we do role plays. We talk about those things that we talked about earlier on, things like managing situations, better conditions, effective data gathering, interpersonal skills, or audiobooks, online, and flashcards. MRCGP, the bulk of what we do. AKT, RCA, again, Gold Pass packages for this. Make sure if you're doing AKT, you print and download our day-by-day countdowns. We've just started the 120-day countdown for October. We're going to be releasing the 150-day countdown for the next exam, and our 90-day one for October as well, coming up very soon. And then we've got all the various resources that we do, live courses, audios, mocks, flashcards, online courses. The most of what we do is for these two exams, RCA and AKT, and then of course medical school as well. We've got medical students on from all over the world today. We have audiobooks and we have flashcards, both clinical and communication skills, things that medical school exams are testing you on day in, day out, wherever you are across the world. So take-home messages, the past cycle. Yes, do lots of work, but please pay attention to these 5 things. Become aware of the exam that you're about to do. Don't go into it without thinking what is out there for me to help. Plan. If you don't plan, like we heard earlier from Parveen Kumar, if you fail to plan, you plan to fail. Like, you've got to plan things properly. Number 3, yes, get your knowledge up, but make sure you do it smartly. Don't just go and try and learn everything under the sun. Focus, target on what needs to be learned, what doesn't, what's high level, what's low level, and make your knowledge high in an effective way. Don't neglect technique, whether it's an MCQ exam, whether it's a role play exam. Do not neglect technique. Don't just think it'll all come together. Focus on it, understand it, work on it, practice it, and then get it all right by applying it. Do your mocks, do your regular questions, do your practicing, do your role plays, but make sure you self-critique afterwards and you really get the most out of each session that you do. Therefore, you can go up the ladder and you start to feel more and more confident. Any exam is passable, guys. Any exam is passable. There's no exam that should stop you. If you've got to this stage, you've got all the raw ingredients to get through any medical exam. You've just got to focus a little bit. Keep things varied, whether that means vary in terms of learning styles, whether it means varied in terms of doing it at different times of the day. Keep things varied, because monotony is going to draw you down. It's human nature. Mindset is more than everything, guys. If you haven't got your mindset right, the hours that you do not reflect on the results that come back. There is no doubt about that. And can pass, will pass. If you don't go into any exam thinking you can pass it and you will pass it, you're already deflating your chances going forward. I really hope there's been some value. I'm a little bit over time, but if there's any questions, I'll try and answer them, and then we'll quickly move on to the next session. But any questions throughout the webinar, the conference, just ping them and I'll respond to them directly and privately, or you can get me on social media 24/7. I'm there to support you get through your exams, but also maximize your potential in your career as well. Thanks, guys. Hope this helps. Any questions, Pooja?
Yeah, so lots of questions have come through, as expected, in relation to the exams. What's the difference between the PLAB Live course and the PLAB Gold Pass package?
So the PLAB Gold Pass package contains the live course. Firstly, it's one of the live course is one of the components of the Gold Pass package, but the live course itself is purely role play. So it's a virtual course, and you do it from home wherever you are in the world. It's a live half-day course, and we basically just role play and feedback, role play and feedback, role play and feedback, and we work on those little techniques that can make a big difference when it comes to your 8 minutes. The live course can be bought separately, or it is part of the Gold package, which is everything and combined, including the online course, the flashcards, and the audiobooks as well. So the Gold packages are all the all-in-ones, and then you have the individual components as well. And you can choose which date you want in that Gold Pass package.
And another question, I've noticed that you have mock exams. How is this different to question banks?
So question banks are things that you go in and just do little bits here and there. So I'll do an hour here, or I'll do like 10 questions here, and you're not really in that frame of mind of pressure. So we don't have question banks per se, we have online mocks. So you purchase a bundle of 1, 3, 5 mocks or whatever it might be, and they're preset to the exam style, and they put you in the exam pressure, because it's one thing to get lots of questions right when you're not in pressure, but then to do it when you see a time ticking is very different. So that's why we've designed our mocks as opposed to just questions. At AKT, for example, we have currently 5 mocks, so there's 1,000 questions there, but they're split into 5 exams.
Okay, and one final question. Are the medical explanation audiobooks useful for MRCP?
For MRCP, yeah, because the explanation products that we do, whether it's the flashcards or the audiobooks, are designed across board. So whichever exam you're doing, if it's got components of role play, discussing with patients, then those explanation cards and audios are useful because they allow you to break down. But often what we see is people spend a lot of time explaining concepts like tests, investigations, diagnoses in way too much time, eat up too much pressure, and put people more confused. So those are designed to cut those down to very simple, focused, short and sharp explanations that can help in any particular type of exam.
Brilliant. Right, any more questions for Aman or myself? We'll continue answering them in the question section. And apologies, guys, we've run a bit behind.
Just one question that's coming about the mocks. Yes, there is feedback. When you do a mock exam, you get a breakdown of all of your scores, but you also get a breakdown in sections. So cardiology, respiratory, gastro, what was your percentage? And obviously, and then you get feedback after every question as well at the end, which you go through in a question by question basis. But happy to stay on and ask more questions over lunch as well.
Bro, thank you.